you?
Good, how are you?
I'm good. My name is Gracie and I'm going to be your student nurse for the day. I'm going to start off with some hand hygiene, wash my hands, and I'm going to pull this curtain and provide us with some privacy. I do have some questions for you today. So first, what is your name and date of birth?
Abby Spires, 11-10-05.
Okay, and let's just check your wristband. All right, you're good. And then a couple more questions. So have you fallen in the last 6 months? No, okay. And do you take any medications? Okay, all right, well, based on the questions and a visual assessment, you're a 0 on the scale, so you're good. Have you been in any pain lately? No pain, all right, good. I'm gonna give you a couple tips on safety just because of the situation. So you are in a rolling chair and that can be a hazard, so you wanna make sure you're being really careful, getting up, sitting back down. And then there are a couple of things on the floor that you may could trip over, so just be really careful to watch out for that type of stuff. But if everything makes sense to you, we'll get started on everything, if that's okay with you. All right, so I'm gonna start off respiratory, as long as that's okay with you. I'm just gonna do some listening. So we're gonna start off with your right upper lobe, left upper lobe, left lower lobe, right lower lobe. All right, and if you'll turn that way, I'm gonna check you laterally. So right lower lobe. Good, and other side. Left lower lobe. Okay, and I'm gonna check your back. No, sorry. Okay, we have your left upper lobe. Right upper lobe. Right lower lobe. Left lower lobe. Okay, everything does sound normal with that. So you're unlabeled, normal, that'll be pneumonia, so sounded good. Have you been having any chest pains or anything like that? No chest pains? Good. So we are gonna go ahead and move on to our cardiac. Okay. All right. So I'm just gonna start off by checking your pulse, making sure everything's good. All right, both feel good, +2. Are you okay with taking your shoes off today, or is that an issue? Okay, that's an issue. So I'm just gonna demonstrate like we would. So we have our dorsalis pedis, and that's gonna be right here. And then we have our posterior tibial, and that's gonna be right here. All right, and I'm gonna show you some other places we could check. So we have your carotid, and then we have axillary, brachial, femoral is right here in that fold right there, and then popliteal. All right, and since we have that all good, I'm gonna just listen to some more heart sounds. We're gonna start at your aortic, and that is the second intercostal space. All right. Good. Pulmonic, second on the other side. All right, Erb's point, and that's the third. Tricuspid is the fourth. And then we have your mitral, and that's in the fifth. All right. Sorry, I'm hungry. Okay, and I'm just gonna have you lean back in the chair at a 45-degree angle, and you're gonna look to each side. Good, I'm just checking for any JVD, but you're looking good, so you can get back comfortable. And I'm going to press on your nails and make sure your capillary refill is good, which it is because it comes back within 3 seconds. So I'm gonna go into checking for any edema. Good. Good. All right, and have you been having chest pains, anything like that? No? Okay, well, I think we are good for the day. Oh, yes. So I will just give you a little more information. If I was gonna be checking for murmurs, I would actually use this side of the bell, the smaller side.